Today's webinar, Serving Young Homeless Children under the Child Care and Development Fund Program. This webinar is co-hosted by the National Center for Homeless Education and CCAoA of America. We're so glad you've joined us, and we'd like to introduce ourselves to you at this time. So you'll have 4 presenters, and I'll get us started. My name is Christina Dukes. I'm the Federal Liaison with the National Center for Homeless Education, or NCHE, and we operate the U.S. Department of Education's Technical Assistance Center for the Federal Education for Homeless Children and Youth Program.
And I'm Kim Engelman. I'm with CCAoA of America. I am the Chief of Family and Community Engagement there.
And good afternoon. My name is Janetta Green. I'm with the Alabama Department of Human Resources. I'm the Child Care Services Division Director, and I am the CCDF Administrator. DHR is the major social service agency in the state of Alabama with programs such as SNAP, Protective Service and Foster Care, TANF, and Child Support, as well as the Child Care Services.
And good afternoon. I am LaDonna Rudolph with Alabama Department of Education. I am the State Homeless Coordinator from the great state of Alabama.
All right, so I have a smile on my face because I have a great team of women here co-presenting with me, and we're also, again, so glad that you've joined us to be part of today's webinar. So first, let's go over where we're headed today. To set a little bit of context, we will discuss understanding the dynamics of family homelessness. For many of you, working with homeless families with children may not be the primary focus of your work all day, every day. And so understanding some of the dynamics of family homelessness may be helpful for you as you embark on this new, more concerted effort to serve homeless children under the CCDF program. And to that end, Kim will discuss some new pieces that are required as a result of either legislative provisions or some new practices that are required by the Department of Health and Human Services in terms of serving homeless children under the CCDF program. She'll also discuss some general strategies for collaboration between child care and homeless education, and then we'll hear from Janetta and LaDonna about some of the work that they've begun in the state of Alabama to serve young homeless children under CCDF. Of course, we will be stopping at several points throughout the presentation to give you time to ask your questions. Now, you've learned a little bit about us. We'd like to do the same, and so we have a quick poll for you, an anonymous poll here. Which of the following best describes your role group? We'll give you a few seconds to vote, and then we'll share group results. We'll give about 5 more seconds for voting. All right, so here's who's with us today. We've got a nice mix. We've got about 32% of our people are either our state coordinators or local liaisons, so representing the homeless education community. Welcome. And we've also got a decent representation from the early childhood community, some folks from CCR&R agencies, CCDF state lead agencies, and then even some of our direct early care and education providers. And then about 36% of you are from another role group. So thank you everyone once again for joining us, and we hope that today's session will help all of you in your daily work. So let's look now at the issue of family homelessness, and I'll be providing a little bit of context to set the stage for the rest of our discussion. Well, that's right, we've got one more poll for you. So sort of a pre-test, if you will, to get an idea about your understanding about how common is homelessness among young children. And so the question for you is this true or false? More than half of children staying in homeless shelters in 2014 were under the age of 6. All right, just a few more seconds for voting. And we definitely have a well-informed group here today. Those of you that said true, 85% of you, that is correct. And we'll see the actual specific statistics and their source in just a few slides. So homelessness among families with young children is common and is happening, and a lot of the children in our public shelters are actually under the age of 6. So what are some of the causes of family homelessness? In large part, family homelessness is a function of economic challenges. What do we mean by that? It is in large part based on a simple lack of affordable housing. I know many of you probably can relate to this. So I live in Washington, D.C., which is an extremely difficult housing market, but that is a fairly common issue across our country, that people just aren't making the wages that they need to make to be able to afford housing in their area. And this relates to the next several issues. So poverty, unemployment, or underemployment. Some of our families simply aren't able to make a truly, what we would call a living wage, to be able to afford fixed, regular, and adequate housing and all the other expenses that come along with a family. Some of our parents do have low education levels, which is going to make it difficult for them to get jobs that pay a living wage. And then also many, and what you will see when you look into the statistics of families with young homeless children, is that you will see a lot of single parent households, which also means single income households. And so again, you've got all those challenges of affording housing and paying all the expenses related to raising your children on a single income. We do also see health challenges among our homeless families. That can include disabilities, mental health issues, or substance abuse. Domestic violence can lead to homelessness among families with children. And then what we call low social capital. And what that means is when a family is going through a difficult time economically or otherwise, they may not have the network to pull from that can help keep them stable and support them while they hopefully work their way through whatever that crisis is and make it out on the other end. Many of our families, maybe some of their friends or families are in the same situation, and so if one particular family is really struggling, they may not have other families that they can go to be able to help support them during that difficult time. So here's a little bit more data for you, and this is from an HHS report, Health and Human Services report, that you see along the right side of your screen there. So about 6 million children under 6 years old lived below the federal poverty level in the year 2013, and that basically is around 1 in 4 children. So around 25% of our children are living in poverty, or at least did so during the year of 2013. Around 50,000, this is based on data from Head Start and Early Head Start programs, around 50,000 young children experiencing homelessness were served in those programs in that same year. And then U.S. public schools, so we collect data on homeless children all the way from pre-K up through high school. And during the 13-14 school year, U.S. public schools enrolled also around 50,000 children ages 3 through 5 in public preschool programs that were administered by schools. A little bit more information. Here's where that poll came from. So this comes from data from the U.S. Department of Housing and Urban Development. So they collect data each year, both at a point in time, which means that on one night in January, they collect data on homeless, sheltered and unsheltered homelessness. But they also do a cumulative count where they collect data for the full year. And what you're seeing on your screen is data for the full year something's blocking my screen here, in 2014. So again, of sheltered homeless children and families, about 50% were under the age of 6. Now there is sort of a little asterisk there that HUD does use a narrower definition of homeless than what we're going to discuss in a moment. So just kind of keep that in mind, that these numbers don't always maybe match up in the way that we think that they should, but that is in part because the criteria that are used to define homelessness are different. Let's look at the McKinney-Vento Act. So this is sort of my wheelhouse at the National Center for Homeless Education. The McKinney-Vento Act, or technically Subtitle 7B of the McKinney-Vento Act, is the primary piece of federal legislation dedicated solely to the education of homeless children and youth. Now, it is a very exciting time for us in the homeless education world because even though we are part of the broader McKinney-Vento Act, technically, since we are an education subtitle, we are reauthorized with the Elementary and Secondary Education Act. And for those of you who have been keeping up with this sort of thing, you'll know that the ESEA was reauthorized in December 2015 by the Every Student Succeeds Act, and that includes a number of significant changes in our education subtitle. And those changes, again, it's a very exciting time for us, those changes are set to go into effect on October 1st. Now, one of the key things that will be relevant for today's discussion is that the McKinney-Vento Act establishes the definition of homeless used by U.S. public schools and many other federal statutes or programs. And you can see that list of the different programs that use our definition of homeless for program administration purposes. So what exactly is our definition of homeless? Now, for some of you who maybe haven't worked very long in the field of homeless education or don't have a lot of experience working with homeless families or children, this might seem a little broader than what you would expect. And I'll share in just a few slides why that is the case. But again, what we're looking at right here on the screen is the McKinney-Vento definition of homeless. And we have what is called a guiding phrase, which reads, children or youth who lack a fixed, regular, and adequate nighttime residence. And this definition is important for CCDF programs because, as Kim will explain in a moment, this definition here is what CCDF programs have begun using for data collection purposes under the CCDF program. So again, just focusing in on this, as this is the definition that you will be using in your programs to record data on the homeless families that you are serving. So again, back to the guiding phrase, lacking a fixed, regular, and adequate nighttime residence, and then the definition continues with some bullet points that describe living arrangements that are considered homeless because they are not fixed, regular, and adequate. Now, NCHE does entire hour or hour and 15-minute webinars on this topic alone, and so the definition can be a bit nuanced. So we're just going to do kind of a broad brush today, but just know that additional TA is there for you if you want to take a little bit of a deeper dive. So the first bullet, sharing the housing of other persons due to loss of housing, economic hardship, or a similar reason, is a very important part of the definition. At least in federal U.S. Department of Education data, according to that data, about 3/4 of our homeless children and youth fall under that category. It is oftentimes informally referred to as doubling up. It is important to pay attention, though, that the definition does not just read sharing the housing of other persons and then stops. It adds some criteria that we should be looking for, in that it's due to loss of housing, economic hardship, or a similar reason. And again, for each of these sub-bullets, we are also looking at that broader phrase at the top, is it a fixed, regular, and adequate nighttime residence? Moving on, next we have children and youth who are living in motels, hotels, trailer parks, or camping grounds, again paying attention to the wording, due to the lack of alternative adequate accommodations. We do get questions sometimes about trailer parks. I grew up in South Florida, and so mobile homes are very common. So we're not referring to fixed, regular, and adequate mobile homes. This would be more likely referring to something of the most temporary or substandard nature, so maybe like a pop-up trailer, and its proximity to the phrase camping grounds is also significant. So again, this is not your everyday mobile home. This would be something that is not fixed, regular, and adequate. And then what a lot of us think of when we think of people experiencing homelessness, children and youth living in emergency or transitional shelters. Also, children and youth awaiting foster care placement. I won't spend much time on this because as a result of the reauthorization of the McKinney-Vento Act, this piece of the definition is actually going to be removed on December 10th. And so you will no longer need to understand very much about that piece of the definition because it will actually be removed from the definition completely. And then just for those of you who are concerned, those children in all stages of foster care involvement will be served in the public schools under Title I, Part A. And then a couple of bullets that are related, living in a public or private place where human beings really aren't supposed to live. And that could be places like cars, parks, public spaces, abandoned buildings, substandard housing, transit stations, or similar settings. This also includes migrant children who are living in any of the above circumstances, or children who are on their own and living in those circumstances. So you may be scratching your head a little bit and thinking, you know, that's a little bit broader than what my idea of homelessness was. And so if you'll give me just a moment, I'll explain to you why the U.S. Department of Education definition, which again is used by many other federal programs and statutes, is a little broader. One of the main reasons is that shelters are often not an option for families, and that's for a number of reasons. Most shelters are concentrated in population centers, which means urban or suburban areas. And so if a family is not living in an area with a shelter, that will not be an option for them. Also, many shelters are full. So even if a family lives in a community with a shelter, they may not be able to stay there because there may be no space. Also, families and youth may avoid entering shelter simply due to concerns over the shelter environment. Is it a safe place for my children? I don't have control over this entire environment. We're interacting with people that we don't know, and I'm just not sure if that is a safe place for me and my children, so I hesitate to go there, and I may look for any other option except for going into shelter unless that is absolutely the only place we can go. And then some shelter policies either do not allow adolescent boys, or they may have stay limits. So even if a family is in a community with a shelter with space, they may only be able to stay there for 30, 60, or 90 days. And so what we often see is that our families look to stay with a neighbor, stay with an extended family, stay with a relative, a friend. Some of our unaccompanied homeless youth will even end up staying with people they barely know and often end up compromised because of that. And those arrangements oftentimes are not as stable or safe as maybe we would imagine them to be. And so we have these young children who are bouncing around between living arrangements that are unstable and oftentimes inadequate, and there is an effect on our young children because of that. So we see, first of all, this issue of high mobility, and it's what we say are its trickle-down effects. Moving around constantly can be very destabilizing. It's difficult to build lasting connections and even have what we refer to as educational continuity. You know, if a child's doing well in a particular program and then they have to move, then it's maybe there is no program in the new community, and wow, I made friends and actually liked my teachers, and now I have to go somewhere else. And so all of that destabilization that comes with homelessness and moving around. As a result, we see, as you would imagine, higher than average rates of emotional, behavioral, and health issues in our young children who have experienced homelessness, and some of those things that just go along with the financial strain that most of our homeless families are dealing with. So lack of food, and even, as we mentioned, domestic violence sometimes can lead to homelessness, and so some of our young ones have witnessed violence within their family. According to a study by the National Association of the Education for Homeless Children and Youth, even though our young homeless children are some of the most needy of quality early care and education services, they oftentimes have very low rates of access to and enrollment in those very services that they need most. And a lot of that is, as I mentioned, high mobility can make it difficult for our programs to identify and engage with families. Also, many programs are full, so it's similar to shelters, right? There may just not be enough slots, and so programs end up turning children away. Also, sometimes there are enrollment requirements related to documentation that can be a barrier to our homeless families, but as Kim will tell you, CCDF is now seeking to address that barrier, and then sometimes our kids simply cannot get back and forth to the program. So that will provide us with a bit of context for the rest of our discussion. I'd like to invite you guys to type in your questions into the questions pane, and I'll see if I can address some of them now. Let's see. Okay, so we have a question, and I like this because this one I can actually answer. What is CCDF? So CCDF is the Child Care and Development Fund, and Dr. Kim Engelman will be discussing that program in more detail in our next section. Let's see, to confirm, does the New Jersey Department of Education use this definition of homeless? Yes, it does. That is established in federal statute. for the Education for Homeless Children and Youth program. And Danielle Anderson-Thomas is your state coordinator for homeless education, and she will confirm that that is the definition used in your state. Let's see. Okay, for fixed, regular, and adequate, are there any time limits placed on how long a family remains in a location that will constitute what is not fixed? We get this question quite a bit. So the short answer is no. There is no sort of black or white type of standard for this. The Department of Education has not given anything specific either in statute or any kind of guidance, which sometimes we find programs sort of struggling with that or feeling a little frustrated. The good news is that it does give you some flexibility and discretion, and the reality is that homelessness isn't always something that families can quote-unquote control and resolve easily. And so in the case of, we will occasionally see a shared housing arrangement that begins as homeless because of a crisis, but over time does become fixed, regular, and adequate as maybe the initial crisis has ended, and yet it just seems to make sense for the parties to continue living together, and it is fixed, regular, and adequate. In those cases, at least for school districts, we say that would be something you would want to look at, looking at eligibility again at the beginning of every school year. Let's see. Will we have to keep track of Head Start children that are homeless? So we're really focused on CCDF today, but I do believe that, and maybe Kim wants to chime in here, I do believe that there's also a requirement under Head Start to collect data on the homeless children that you are serving. And I just will open that up to Kim. Do you know anything about that, Kim?
Yes, I do believe that that is a requirement as well for the Head Start's performance standards as they're working to align CCDF and Head Start.
All right, and with that, let's go ahead and move into our next section where Kim is going to talk about serving homeless children under CCDF, but quickly we'd like to do one more poll to get you engaging with us. So true or false? Beginning in October 2015, CCDF providers must report on whether the families they serve are homeless. We'll give about 5 more seconds for voting. And I'm going to turn it over to Kim to debrief the poll and carry us into our next section. Kim?
All righty. Well, we have a great group of participants here, Christina, Jeanette, and LaDonna. They are very on top of things. So yes, the answer is true. Beginning in October of last year, CCDF providers must report on whether the families they serve are homeless. And we've got 70%, as you can see, who have indicated that is true, and a few that are unsure as well. So we hope that we'll be able to provide a little bit more information about CCDF to those of you who may be a little less familiar. That's what I'm going to be doing coming up next. So Christina, you can move to, yep, there we go, to the next slide. So that the Child Care and Development Block Grant was signed into law by President Obama in 2014. So just a little bit of background for those of you who may not be in the early care and education field, who may be on the homelessness liaison or state coordinator side, or in that other category outside of early care and education. So the President's signature reauthorized the child care program for the first time since 1996. So this is long overdue, and it represents a historic re-envisioning of the Child Care and Development Fund, or CCDF for short, program. The law makes significant advancements by defining health and safety requirements for child care providers, outlining family-friendly eligibility practices, and ensuring parents and the general public have transparent information about child care choices that are available to them. So the CCDBG Act of 2014 includes a number of new program requirements. In some cases, the law specifies a particular date when the provision is effective, And effective in October 2015, as you all just noticed, many of you noted that you already knew, CCDF providers must report on whether families they serve are homeless. So again, those of you who are involved directly in the reporting of this information, like the state administrators for CCDF who are on this webinar, most likely reflect the 70% of you who just answered true to the poll question that we just had up on the screen. And you likely are well versed in the Administration for Children and Families ACF 801 form. This is the reporting document used for national data collection. And these data will be used to assist in addressing national child care needs, performance measures, and the provision of training and technical assistance to improve the quality of child care. Now, the new CCDB requirements elevate families experiencing homelessness as a priority to serve. So CCDF administrators are out there working diligently to carry out CCDBG provisions. Earlier this year, they submitted their own state's CCDF state plan and received green lights this summer to proceed with their plans. These current plans span 3 years from 2016 to 2018. This reflects a change from prior requirements where new state plans were drafted every 2 years, and now we're on a 3-year cycle. CCDBG did require CCDF lead agencies at a minimum to touch base with their state homelessness coordinator to coordinate plans for supporting families experiencing homelessness with young children as they were developing their CCDF state plan. And it's our hope that by using platforms such as this webinar with all of you on the phone and online with us, state coordinators, state homelessness coordinators and liaisons, state CCDF administrators, child care resource and referral, early care and education professionals, and others who are interested stakeholders, we hope that we can spark or rekindle these relationships. So CCDBG also requires the establishment of a grace period to allow homeless children to receive services while families comply with immunization and other health and safety requirements. So those are 2 of the requirements. Moving forward, CCDBG also requires a focus on improving access of children experiencing homelessness to child care services. As Christina noted earlier, children thrive in stable, supportive, and predictable environments. And stable child care arrangements and routine engagement with early care and education teachers and program staff can serve as a nice, solid foundation for children experiencing homelessness, and also provide adults in the family with more space to stabilize the situation in which they find themselves by doing things such as attending to their family housing situation or engaging in job training. CCDBG is set up to facilitate the provision of full-day programming for children experiencing homelessness and requires the coordination of services with other federal, state, and local level early childhood programs, including those serving homeless children. So the application of this requirement includes collaborating with other federal, state, and local early care providers that serve homeless children for the provision of full-day programming, conducting specific outreach to homeless families, and then providing training and technical assistance on identifying and serving homeless children and their families. And lastly, as you've already heard, CCDBG requires providers to collect data on whether the children they serve are homeless. So in, next slide, thank you. In reference to the new reporting guidelines, the first link that you see on the screen, near the bottom of the screen here, will take you to the reporting instructions for the ACF 801 form that I mentioned earlier. And the second link takes you to the actual form. Now, don't worry about scrambling to write down these web locations, because at the end of this webinar, you'll receive a link to the presentation slides and other resources. I just wanted to point out at this point in time that ACF has online resources to help you understand these new reporting requirements. And also, as Christina established earlier on, while there is more than one definition of homelessness that has been used in the health and human service sector, the McKinney-Vento Act definition of homelessness is what's being used by entities such as the Department of Education and the Administration for Children and Families, Department of Health and Human Services. Okay. And in the CCDF, if the CCDF regulations are new to you or you just want to dig in more deeply, the most recent version was published in 2015. This is the Notice of Proposed Rulemaking for the Child Care and Development Block Grant. The link is on the screen in front of you. These are the proposed regulations. The final regulations are anticipated to be released in the near future. Word on the street has them being disseminated before the end of this year. So be on the lookout for those. So now we're going to move to strategies. So what is it that you can do now? Here are a few strategies now that we have the CCDBG and CCDF basics behind us. Here are a few strategies that you might be able to begin thinking about. So state coordinators and liaisons on the line and in the web meeting room, we encourage you and others with a limited familiarity with CCDBG to do a bit of homework and engage in a little light reading, I say with a grin, of the proposed CCDBG regulations or final CCDBG regulations once they come out later this year. Doing so will help everyone be on the same page with implementation and be on the ready to collaborate and to serve families experiencing homelessness even better than you already do. We strongly encourage reach outs to your state coordinator and local homelessness liaisons for homeless education. Make a new friend. Get familiar with each other's roles, what each of you and your organizations have to offer, and resources that you can share or leverage. And if you're not familiar with who your state coordinator is, please feel free to reach out to Christina and her colleagues at the National Center for Homeless Education. And on the flip side, if you're a state homeless coordinator or liaison and need to connect with early care and education colleagues, feel free to give me a shout, and I'll be happy to put you in touch with your CCDF state administrator and your local child care resource and referral agency. My contact information will be posted with Christina's, Janetta's, and LaDonna's at the end of the slide sets that you'll receive following the webinar. Alrighty, so to get your networking juices flowing, here are just a few examples of partners you may seek out to explore connections for serving families experiencing homelessness. We've already mentioned a few, CCDF lead agencies being one, state coordinators and local liaisons for homeless education being another, child care resource and referral as well. There are many others that you might consider, including Head Start collaboration directors, state councils or early learning advisory committees, early intervention personnel, public benefits programs like HUD, TANF, SNAP, etc. These are just a few ideas for you to get, as I mentioned, to get the juices flowing. In order to best serve families experiencing homelessness, there's not one organization that can do it all. We need to band together in our various different disciplines to really lift up and elevate families experiencing homelessness. So next, we're going to pause once again to check in with each of you. And please feel free to elevate any questions that you have that have come to mind to you so far. You may type it in the chat box, and I'm going to hand things back over temporarily at this point in time to Christina.
Okay, so Kim, I'll just field a couple of questions your way. And again, as a reminder, you can type your question into the questions pane and I'll share it with Kim. So we do have a question from Bonnie. She says, I'm a public school director of child care and have a homeless family who needs child care. Where do I begin to seek out funding for them? Do you want to take that, Kim? I'm not sure if, well, yeah, okay, I'll just let you take that, Kim, and then if you are stumped, I can maybe add a few thoughts.
Sure. So to seek out funding for families, if you want to seek out assistance through CCDF, I would recommend that you reach out to your CCDF state administrator. And Bonnie, if you email me, I'll let me know what state you're from, and I'm happy to share with you your CCDF state administrator contact. That would be the first place to stop in order to explore funding options for children with experiencing homelessness that you encounter.
Okay, and then we've got a couple of questions that we could look at now, but I also know LaDonna and Janetta may discuss it. I'll go ahead and throw one out for now and see if it sticks. Okay, so Belvy says, can you give some examples of how to do outreach to homeless families? Kim or LaDonna or Janetta, or I could provide a couple of thoughts as well. Well, okay, how about this? I'll get us started. So a really, really good first step is reach out to the local homeless education liaison in your area, at the school district for your area, because local liaisons are enrolling school-age children, and even if there is a school district-administered public preschool program, are interacting with, basically they're interacting with families all the time, and many of them have young homeless children, and so connecting with your local liaison is a win-win, because they're going to help you find young children who need those services, and then it's also going to be a relief to them, because when they have a family that they're enrolling with who has school-age children, they'll be able to say, and guess what, I have good news, I can refer you to this person who can help you with some care for your youngest child. So that's a start. Kim, do you have any thoughts?
That was my initial knee-jerk reaction to those local liaisons can really point you in the right direction and can also filter information on child care, fee assistance, and services and other related health and human services for families to folks who directly serve families experiencing homelessness, like at homeless shelters. And the like.
All right, and then, and as I remember in the CCDF state plan preprint, it does give some specific suggestions for agencies to connect with, including shelters and the like, for help in conducting outreach. So you might want to check your state plan preprint as well. And then,
absolutely. Christina, one more thing. One of the resources that we're going to provide a link to at the end of this webinar also provides some suggestions too. It's from ACF. It's a couple of years old, but it's still very relevant. It will also provide some examples of how you might be able to outreach and networking opportunities. So I'll point that out at the end.
Perfect. And then we'll take one more question and then we'll move on, and we are excited to hear from LaDonna and Janetta. So Tina says, if a student, or in this case we could say a family, right, with a young child, is couch surfing, do they still qualify as homeless? A counselor here does not seem to think so. So while the terminology couch surfing is not listed or included specifically in the legislative definition of homeless, what we often see is that is one sort of informal way to refer to families who are doubling up because they have nowhere else to go. So again, I'd want to hear a little bit more about the particular circumstances before I could give sort of a blanket hard and fast answer. But yes, in most cases, couch surfing is a homeless circumstance. It's basically a youth, or maybe you have family who's doing just what it sounds. They're bouncing between different houses, maybe staying on the couch. And those are oftentimes very temporary situations. And if you are dealing with someone who's maybe not completely understanding the definition of homeless, feel free, of course, to refer them to me. And at this point, I'm going to turn it over to our colleagues, Janetta and LaDonna, and we are very excited to hear from them because they are out on the forefront getting things started for serving young homeless children in Alabama. And so we are very happy to hear from them. So Janetta and LaDonna, take it away.
Hi, everyone. This is LaDonna, the Alabama's homeless coordinator for the state. And first, Janetta and I want to give you a little information about our great state. In the area of homeless, Alabama, in their last national reporting, reported 733,000 children in K through 12 and 11,149 pre-K kids. And under the law, you know, Alabama is required to have a homeless liaison in every school district. We now have 136 school districts. And as you can see, that's a little overwhelming. So Janetta and I are going to talk about how we became partners and how we became a team to ensure that this information got across our state.
And I'm going to tell you a little bit about our Alabama Child Care Subsidy Program. We are currently serving more than 33,000 children. There are more than 1,500 providers who participate in the program. The majority of those are center child care providers serving more than 12 children each day. And then there's also providers who are our licensed family home providers. Within that arena, we have child care management agencies, which I refer to as CMAs. They are our agencies who do eligibility for the subsidy program, and so they are in 9 regions across the state, so we are serving every county in Alabama. So this collaboration on what we wanted to do and what we had planned to do for our CCDF to meet those CCDF regulations, but also collaborating with our homeless liaison was very important for us to be able to get consistent information and consistent policy across our 67 counties.
Okay, this is how it started. Back in early January, I received an email which informed me that the Child Care Citizens Coordinating Committee was meeting, and they were seeking input for the CCDF state plan. They wanted to develop a partnership, and they wanted to talk about new initiatives which specifically will reach out to our homeless families. And then a little later, a couple of months later, I reviewed the pre-public comment versions of the state CCDF plan, which was emailed to me by Christina from NCHE. And I found that very helpful because I was able to look at what was being said out in the field about our homeless families and accessibility to the program. So that was basically how it started. And that opened the door for me and allowed me to reach out to our state person who was the developer of this grant.
And our Child Care Coordinating Committee consists of more than 25 individuals who are members of state agencies and advocacy agencies that focus on the needs of families and children. So we thought this was a perfect group for us to bring our CCDF state plan, our ideas about how we want to go forward. They kind of serve as an advisory group to our child care division to help us on issues related to that and kind of give us input. So it was just wonderful to make the connection with LaDonna as we were thinking about our policy. What would our policy be for homeless families? How would we impact those homeless families? How would we develop training and technical assistance and outreach for those homeless families? So this avenue of the coordinating committee became a great avenue, and so having the Department of Education has been a member of that committee that helped us make contact with LaDonna to help us with our homeless policy.
Next slide. Okay, what you see now is a copy of a one-page agenda I created to bring all of those agencies. We have our annual city and county homeless meeting, and I saw this as a perfect opportunity to include Janetta because I wasn't familiar with what all the requirements were for the CCDF. So I contacted Janetta and I asked, I said, well, Janetta, could I give you a block of time so you could come and update our homeless coordinators with the information? Tell us about the state plan. Where are we with the state plan? What exactly is the state plan? So this was a perfect opportunity for Janetta to meet the group that I facilitate and to give us the information we needed.
Being a part of that group actually helped us fine-tune our focus. So I went to that meeting with the understanding that I would be telling them about what we have, but they actually helped me by giving me strategies on how we can truly make an impact with our homeless families. So some of the things that came out of that meeting was that they stressed to me how important it would be that even though we are giving homeless families more time to provide documentation, that wouldn't help because in the state of Alabama we have a waiting list for child care. So unless they could get in, this additional time for documentation did not help. So that helped us change our focus from just giving them additional time to document their eligibility to also giving them priority over the waiting list so that they could be determined eligible and given additional time to provide documentation. So as part of this meeting, we changed our focus of what our policy would be and added a priority for our homeless families so that they can get into child care more quickly. That meeting also helped us understand that need among minor parents. It's one of the things that the homeless liaisons made clear to us was that need that they have for teenagers who also may have children of their own, and they're also part of homeless families. So we already had a priority category for minor parents, so we were able to share that information with the liaisons so that they could bring that information to those families that they were dealing with and maybe get those to the right organization to receive help with and assistance with child care.
Next slide. Okay, where are we now? Really, Janetta and I, we have a lot of contact now. There has been an increase in contact between the Division Director for Child Care Services and a lot of contact with me. And we talk on the phone all the time. We share information. If she has a workshop that she thinks will be relevant to my program, she talks to me about that. And likewise, I mean, there's a lot of things going on with Janetta and I in regards to collaborating, making this work so we can meet those needs of those families.
We are setting up opportunities to share resources with our agencies who do eligibility. This information that we're sharing here today that I've heard is wonderful for those eligibility agencies so they can understand homeless families much better, and also our quality agencies who provide training and technical assistance, making opportunities for them to connect with LaDonna so that they can get a better understanding and actually be able to bring better services and much better training to those child care providers so that they can make impacts with their homeless families as well. So we're looking at the possibility, we're looking at avenues where we can connect. We'll also look at avenues where we can share our resources to let them know where our agencies are located, who those contact people are, and then she's allowing us to know where her agencies are and those contact people are as well. We're also talking about referring parents to our homeless liaison. So that's part of what's come out of that, as we do eligibility, regardless of which door the families come through, whether they come through the local liaisons or whether they come through our eligibility agencies, we each can connect them with the resources that they need.
Okay, and that last bullet, which is really important to me, you know, as a state coordinator, you don't have a whole lot of time. So we have streamlined our focus and collaboration to look at the special requirements in CCDF, reauthorization and Alabama child care subsidy policies provision to serve those homeless families. So now we have a clear-cut focus and we can focus in on those needs. Next slide. Okay, moving forward, on the federal program side, there is a lot of joint training for the state homeless coordinator. We're looking for training that we can send out to our districts so those homeless coordinators can be a part of those meetings and get the necessary information to make this work.
I mentioned and previously that we were talking about joint training opportunities for the homeless liaisons, our child care quality enhancement agencies, which operate as our resource and referral agencies in the state, and then our child care management agencies, who are our eligibility staff. So as they are making contact with homeless families, that they will have the information they need. They will have the, they will understand the uniqueness of these families as they are seeking to serve them. We are also making contact locally with each of the individual agencies locally, making sure that they have contact with their homeless liaisons on the local level. And LaDonna's going to tell you a little bit more about how we're doing that.
Okay, one of the things I'm excited about is the web link for homeless liaisons to access the information for CCDF. And also, the state plan is now completed, and that will be publicized as a quick reference on the ALSDE website under our homeless tab. So they won't have to search for that information. It'll be readily available for them, for the homeless liaisons across the state.
So our child care management agencies, our eligibility agencies, have reference to the contact information for all the homeless liaisons and the counties that they serve. And we also gave LaDonna information on who our eligibility agencies are in the counties for those homeless liaisons. So again, from which, if they come through the door of DHR or come through the door of our child care management agencies for eligibility, or if they come through the door of their homeless liaisons, everyone will know the contact information for the resources for those families.
Next slide.
So then as we move forward, again, we're looking at the 3 areas that the CCDF regulations target, and that's where we are putting our efforts under those 3 areas. The first one being access to subsidies. For families who is experiencing homelessness, they will have priority access to child care services. They will not be subject to the waiting list. And in addition, we will give them 90 days to provide documentation of their eligibility. So once they come in and they apply for services, they will be eligible for those services without having to provide any documentation, and we will give them 90 days to provide that additional documentation. We're also doing outreach, and we're focusing on outreach by collaborating with the homeless liaisons in each county to make sure that those families, if we recognize those families as homeless, then we want to refer them to a homeless coordinator or homeless liaison within their county. We want them to be able to make those connections. One of the things that we discussed as we were meeting with our management agencies, that we did not want to know this information about families, know that we have young children who are homeless, and not connect those families with resources. So along with that, we're also connecting them to early intervention if we have children who are at that younger age group that may not be covered by the homeless liaisons, or they are just a family that do not have school-age children, so they may not have made that connection through the school system. We want to make sure that they have that connection through our state early intervention, who also give services to homeless families. And then our training, as part of our new contracts with our training agencies, our quality enhancement agencies who operate as our resource and referrals, there's provision within their contract that they will provide training and technical assistance to child care providers on working with homeless families. So they are starting that process now. So throughout the year, we know our child care providers will receive consistent and ongoing training on how they can work with homeless families.
And that's pretty much it on our end.
That was fantastic. I love it. And you guys were just seamless in the way you guys co-presented. So thank you so much for sharing what you've done in Alabama. We have one last opportunity, so a good few minutes left for your remaining questions. As a reminder, please type your questions into the questions pane. Okay, let's see. Are families required to report homelessness to a school district? The short answer to that is no. So the law places the responsibility for identifying families on the school district. Now, having said that, some families may come forward with that information, but what we see is school districts, just as CCDF agencies are also required to do this, need to be providing outreach so that families are aware, hey, if you come forward and discuss something that oftentimes can be very personal, there may be additional services for you. So the short answer is that while some families may discuss that they're living in a homeless situation, some may not realize they're living in a situation that would be considered homeless, and ultimately their responsibility is on school districts or CCDF providers to outreach rather than on the family. Let's see. Okay. Sorry, I'm just okay. Question from Judith. I had a situation last year where I had an unaccompanied homeless youth who had a small child who needed child care services. The child care was available under our teen program, but as soon as the student graduated, all her child care ended. And so actually, she doesn't go on any further to pose a particular question, but I guess maybe for LaDonna or Janetta, would you have any suggestions for how to help this young woman who's graduated high school and still needs care for her young child? Would she be able to get help under CCDF, or do you have other recommendations?
In the state of Alabama, she could possibly continue to receive that, and so I think that policy just may be a little different depending on what the individual state policies are. For Alabama, our policy is as long as they continue to be in need and eligible for the services, despite the fact that she has currently graduated from high school, we can continue that. And so I think there may just be a difference as it relates to CCDF policy, how the states do their CCDF policy.
And Janetta's correct. Check with your state because the policy is going to vary.
Well, and I'm looking too, she says that the child care was available under their teen program, so maybe she means at the school district. And because the student graduated, then that was an issue. So, hey, this is a great opportunity to connect. Let's see, the child care services ended the day that she graduated. It must have been connected then with her high school attendance. So this maybe is an opportunity to connect with other options for child care, maybe a CCDF subsidy or Head Start.
Correct. That would be a great opportunity for her to look into those other funding sources that also will assist with the cost of child care. Head Start, and sometimes your Head Start, and sometimes there may be local services through local agencies that will assist as well, but definitely your CCDF agencies.
Okay, let's see. Another question. If a child is not in a financial struggle, yet currently living in a hotel, are they considered homeless because the location is adequate? Well, I have a number of questions, right? So first of all, what we don't want, while it is appropriate for a CCDF program or school district to have a certain amount of conversation with a family to understand their situation, school districts or other providers certainly would not be authorized to do sort of like a forensic financial analysis, right? So you're not going to be digging into a family's bills. So at a certain level, you might not be able to truly assess a family's financial conditions. Having said that, I would be curious as to why a family would be living in a hotel. Most of our families live in low-cost hotels and motels because they have maybe a little bit of money to be able to put some kind of roof over their head, but you know, it's a family staying, an entire family in a little motel. Like here in DC, there's a Days Inn that's not too far from where I live actually, where the city actually will put homeless families when shelter isn't available, but also low-income families will stay there. So I would want to know more. If you want to reach out to me after, I would want to understand more. Why would a family be staying in a hotel other than some kind of issue? Why would they not be staying in you know, a home or an apartment? And then also remember, the standard is not just adequacy. It's also fixed, regular, and adequate. So the living arrangement really needs to meet all three of those conditions to not be considered homeless. Let's see. Okay. How about, let's see, we're almost to the end of our time. Let's see. Let me see. Lots of additional questions about the definition. I'll take, let me see, the problem that came up, sorry. Okay, so I'll take one last question. Okay, if a family is staying with their extended family members, such as parents, during a divorce, are they considered homeless? Well, okay, so you guys may have figured out, we have sort of a mantra in the homeless education world that you want to be making determinations of homelessness on a case-by-case basis, because it is very difficult, given the wide range of circumstances that families will find themselves in when they're losing housing, why they lost housing, where they're able to stay, and so it is difficult to make broad sweeping determinations. I would not say, again, not every shared housing arrangement is homeless. You want to look at it. Is it fixed, regular, and adequate? Is it due to loss of housing, economic hardship, or a similar reason? I definitely would not advocate across the board saying if someone gets divorced and then has to move in with a parent, then they're homeless. No, I would not. I would probably want to have a little bit of a more detailed discussion with you, but just know that you want to be making determinations on a case-by-case basis and paying very close attention to what are the circumstances surrounding the moving in and the shared housing, how long is the shared housing arrangement intended to last, etc. Okay, so with that, we are at the, darn it, I forgot, Kim, I should have left you, I could have not answered that last question and given you more time for resources.
No, this is totally fine. So these are, we have 2 slides of resources. The Building Partnerships to Address Family Homelessness that you see on your screen right now is that resource that I referred to earlier on that might provide some ideas for outreach and then networking. Outreach will work best when after you have networked with partners in your arena. And so you'll be able to surf through these resources on your own following the webinar. Once you go to the resource page that you'll get access to following the webinar. I do want to mention just two more things. I am fortunate enough to be a part of the National Center on Parent, Family, and Community Engagement, ACF, one of ACF's training and technical assistance centers, and one of our work plan efforts is focused on homelessness and family well-being. And so this is just a little tickler, a little plug for them. Stay tuned. Later this year, early next year, the National Center on Parent, Family, and Community Engagement will be putting up some interactive homelessness lessons that I think they're going to be fantastic, and they're going to be available to all, but focused on early care and education field, both Head Start and Child Care side. And also in the resources, not listed here on either of these two pages of resources, but available to you on the resource page through NCHE is a new tip sheet that we at Child Care Aware of America have created for child care professionals and early care and education professionals. And it outlines a bit of what it is that on 2 pages, a bit of what we've already covered in this webinar, but feel free to access that and share it freely, and then our website, usa.childcareaware.org, is always available and has packed with tons of information as well. So it's been a pleasure to present with all of you ladies and to engage with a couple hundred of you all across the nation.
All right, well, I would like to thank Kim, Janetta, and LaDonna for the time that they put into helping us get this great webinar together, sharing their expertise. Thank all of you for joining us. You can follow up with any of us at the email addresses you see on your screen. If you have remaining questions, look for a follow-up email where you will get a link to the handouts webpage, and also look for a link in that follow-up email to a webinar evaluation, which if you complete, you will be transferred to a webpage where you can download a certificate of completion. Thank you again for joining us today. We hope you found the session beneficial, and you can close out at this time.